Good morning, dear colleague, dear Sabrina, and all the friends in Tufts Global Health Literacy Leadership Institute for the model for the health literacy leadership and emerging intervention. I'm Professor Peter Chang, an adjunct professor in Tufts School of Medicine and also international director for the Sichuan Health System. I'm very pleased to join you today for a few minutes regarding new dimensions for health literacy plan for working environment. And I will tell you my rationale and share with you the homework ahead of us. Now, every day, there are 7,500 people die due to unsafe and unhealthy working conditions every day. It's including 5 to 7% of the deaths globally. And there are 6,500 people die from related disease. This is the data from International Labour Organization, ILO, and they call every year, the April 28th, the work day for safety and health at work. And there are many, many millions of people die from work-related deaths, and many are die from occupational disease. So it's quite essential for us to make sure we have good attention and concern about this situation. I'll tell you some of my example as a physician in the local. And this is the traditional way of making metal parts that can be used for all kinds of methods. And I'm going to show you one example which is a little bit bloody, maybe disturbing, but which is the case come to me. And this is a young man, 28 years old. He mistakenly put his hand into the machine, which just I show you. And a few seconds later, he come with this, and then he got amputation. And this is right hand. You know, if you got injury in your right hand, you lose a lot of original capacity. There's another example of another young man. He's working very new hand in a rolling machine. You can tell over here. And without pay too much attention to the running machine, he came out with his feet, his right foot, serious injuries and a lot of handicap in the future. And it happened every day, everywhere. And the fact is that all of us work. Work takes more than 1/3 of the human life, you and me. Most of the people in the working environment have no clear idea of the health risk from job. The man I just showed you, they didn't know they're going to happen to this the day before they come to the work. The development of new business around the world render new challenges for health at the job. We care about health in the community, in the patient, but we also need to take care of the health situation for people at work. Work-related health literacy is actually, my understanding, under development, which can be facilitate better occupation safety and health for people at work. And that is the beginning of our thought of we should do something on this. There are a lot of new challenges. The work health hazard on the work is not new. It's traditional. It's always there. But there's a lot of new challenges from digitalization and ICT, and therefore the new forms of health literacy evaluation and intervention are expected. This is some of example. Replicating human thinking, the AI are coming. The visualization of real work, the telework pattern of our new fashion of working remotely. And we have a lot of new human-machine interfaces in between us. And there are smart technology and wearable smart devices, which is good, keep us away from some of the risk, but generate new risk. Automation of robotics, which is pretty important for the modern technology, a new society. Human interaction with AI and robotics, which is new, but how can we avoid new health risk on these new jobs, coming from new jobs, the economic risk, the cybersecurity risk, psychological risk, which is becoming more popular and prevalent in many of the modern technology, modern industries. Automation threat on employment. Yes, we are losing the human contact. And there are also another way of the working environment, the changes in demographics, because the aging society in many of the countries, including, I don't know about the United States, but in Asia, in Japan, Korea, Taiwan, Singapore, many countries are facing, even in China, they are facing aging population and aging working population. The changing global workforce, expanding young and old population in different parts of the world, and because shrink of the young population, young laborers, which is generate aging working cohort population and gender gaps in labor market. You can tell that a lot of old people still working, and a lot of women with new machines, she can work even longer until 60, 70, or even more, higher than that. And this group of new workers population, they need special attention regarding their health on the job. Here is I show you some of example which are prevalent. You can tell them around every corner of the street in Taiwan, and maybe also in other countries. I know in Korea, in Japan, you also see this recycle business, which is very low profit, but is accountable. And you can tell this old generation, most of them, many of them are ladies, they are working in a higher risk environment than before. And genders, yes, they are new generation of women on a job. The gap in labor market are still wide. Women are 26% less likely to be employed than a man, and women are working on less expected jobs. Migrant worker, the World Cup in Qatar, which is bring many of us to the attention of football, but also the migrant workers. Almost 87% of these migrant workers are younger, 20 to 64 years old. The complexity and diversity of circumstances facing them, highly vulnerable to poor physical and mental health outcomes in not well-constructed dormitories and not well-designed working environment. These migrant workers are facing a lot of new challenges, and high-skilled job versus this kind of dirty D jobs, like dirty, dangerous, and demeaning works. With all these new challenges in the health for all people working, do we have a good health literacy strategies? Health literacy is good for health right, good for human right, but do we have a good assessment? Unfortunately, they are only very, very limited, and this is only one example, evaluation of a healthy literacy instrument designed for the mining industry in the United States, which is designed for higher risk production-driven industry, which requires specialized instruments sensitive to the workplace environment and capable of generating comprehensive and representative data with minimal impact of the productivity. And health communication questionnaire has been designed in this study, but absence or high variability of evaluation methods applied to occupational health and safety. And I can tell you a little bit about what do they ask. This is so far the only one example of the health literacy on job survey. They are asking about responding to health information provided by the others. The second category, discussing health at work, home, or with friends. Do they communicate on that? Social health information, seeking health information on the job, achieving control over personal health, and helping others, for example, their colleagues, improve or maintain health. This is one example of health literacy questionnaire survey for the job. And unfortunately, this is the only one so far. I hope. We need to have a more better tools that to evaluate the health literacy on job. And I hope there will be some like this. For example, placement evaluation, where people start to work before they start to work. And I have seen many of the employees, they start a new job evaluation. When I ask them in a clinic, do you know what will happen? What kind of health risk are you expect? Usually they have no idea, even they sit in hours of classes. And a lot of employees are taking the responsibility of security or confidentiality of the job, of the working environment, before telling the workers that they have to take care of some of the health risk. Pre-placement education, which is very important, on-job training and education, and how effectivity of this need to be understood. Job-related health risk communication on the job. How do they communicate between employer and employees? Job-related health risk communication and also health literacy of employers. Not only health literacy of the employees, but also those of the employers. And finally, social responsibility. Health literacy of the regulators, a regional safety security guard, and also the investors, which are putting their money on the stocks and others. And I'm hoping in the future there will be a lot of new evaluation tools, but also intervention that we, as long we have more understanding about the health literacy of the work, they have to face with the challenge for their health, also for their families. So I hope this will be interesting for you, and I hope in the future we can work together on this. And thank you for attention. Maybe you have some question, but I hope we can continue this dialogue. Thank you so much.